Sacral nerve stimulation, also known as sacral neuromodulation, is an option for the management of patients with overactive bladder. The bladder is a hollow pelvic organ that stores urine before it is removed from the body. An overactive bladder, also called urge incontinence, is a condition characterized by involuntary contraction of the muscles in the wall of the urinary bladder, causing a sudden urge to urinate. The symptoms of an overactive bladder include sudden urge to urinate, urinary urgency, frequent urination, and involuntary loss of urine. Conservative treatment of overactive bladder includes lifestyle changes, pelvic floor muscle training, bladder training, and medications. Sacral nerve stimulation is considered in individuals who have found no relief through conservative therapy. Sacral nerve stimulation uses mild electrical impulses to stimulate the sacral nerves at the base of the spine that control the bladder and pelvic muscles. Stimulation of these nerves may alleviate your symptoms of overactive bladder and help restore normal bladder function. In an overactive bladder, the sacral nerves send several irrelevant signals to the bladder, resulting in a sudden urge to urinate. Sacral nerve stimulation interrupts these signals and provides symptomatic relief. In this procedure, a small device known as a neurotransmitter is implanted under the skin of the upper buttock region, and a mild electrical current is transmitted through lead wires to stimulate the sacral nerves. This helps regulate the functioning of the bladder and related muscles. Sacral nerve stimulation is not a cure for overactive bladder. However, it may help reduce the frequency of voids or wetting episodes associated with overactive bladder. Indications: sacral neuromodulation is indicated in people with various bladder and urinary problems, including urinary urgency, frequency of urination, urinary incontinence, leakage of urine, and non-obstructive urinary retention. Procedure: sacral neuromodulation involves 2 stages. Stage 1. This is a test phase where a stimulation lead is implanted in a subcutaneous pocket in the upper outer quadrant of the buttock for 1 to 2 weeks to evaluate the patient's response to the stimulation and check if stimulation improves the overactive bladder symptoms. This procedure normally takes 30 to 45 minutes and is performed on an outpatient basis. Stage 2. This phase is done after successful completion of the test phase. Permanent surgical implantation of the neurotransmitter device is performed in this phase. The procedure normally takes about 15 minutes and is performed under local anesthesia. Your surgeon will make a small incision on the skin over the upper buttock region. Then a small device called a neurotransmitter is implanted under the skin of the upper buttock region. Another small incision is made over the lower back for implanting a long-term electrode. The neurotransmitter device sends mild electrical impulses through a lead to the sacral nerves, which influence the functioning of the bladder, the sphincters, and the pelvic floor muscles. After the procedure. Following the procedure, the area around the incision may feel tender for a few days. You may need to make several visits to your doctor's office to adjust or fine-tune the settings of the neurotransmitter device. Once the settings have been adjusted to your requirements, you may require less frequent checkups, once or twice a year. Limit your activities during the first 3 to 6 weeks after the procedure to allow the incision to heal. After the incision is fully healed, patients are encouraged to resume an active lifestyle. Precautions. The neurostimulator battery life may vary depending on individual settings and frequency of use per day. The entire neurostimulator needs to be replaced every 3 to 5 years. Patients with an implanted neurostimulator device need to avoid MRI scans, X-rays, and radiation therapy, as these may affect the functioning of the device. Diathermy, radio wave diathermy, microwave diathermy, or therapeutic ultrasound diathermy should also be avoided. Always consult your doctor to discuss precautions necessary before undergoing any additional tests. Benefits. Sacral nerve stimulation helps alleviate the symptoms of overactive bladder. It is a reversible treatment that can be removed at any time without any injury to the nerves. Risks. The risks associated with sacral neuromodulation therapy are minimal. However, risks may be caused by problems related to the device or the implantation procedure, requiring a reprogramming of the device. The risks associated with sacral neuromodulation include infection, pain at the implant site, shifting of the lead, technical problems, undesirable changes in stimulation. An overactive bladder can make you feel isolated and embarrassed and disrupt your daily life. Sacral neurostimulation therapy is designed to minimize the symptoms of overactive bladder and help improve your quality of life.